Well, Mr. Chairman, it's an honor to serve even temporarily on this committee as it takes on one of the most important challenges facing our country, which is reform of our tragically flawed and broken healthcare system. And I want to salute you, Senator Dodd, for the exceptional way that you have risen to this occasion in the shoes of your friend and our colleague, Senator Kennedy. The stakes indeed are high. As President Obama said this week, healthcare reform is the single most important thing we can do for America's long-term fiscal health. Savings in waste, confusion, unnecessary or defective care, and illness prevention could exceed $700 billion a year. In the coming weeks, we'll talk a lot about the details of healthcare reform legislation, and those details are important. But even more important are the hundreds of millions of families in each of our states all over this country who've experienced what can only be described as anguish firsthand. Coverage lost or denied, hospital stays extended due to complications or errors, prescription drug bills rising, or losing everything because a loved one fell ill. A few months ago, I launched a page on my website for Rhode Islanders to share their personal stories in our healthcare system. And hundreds of people have written in from all over Rhode Island. Mel, a mother in Lincoln, told me that since her husband was laid off in October, she and her family have found themselves in no man's land. No job, no coverage, no security. She lives day to day with the anguish that she knows she can't afford to send her 11-year-old daughter to the specialist that she needs to treat a pre-existing condition. I heard from Christine in Providence. Under the flawed Medicare Part D prescription drug plan, her mother's medication costs for adult-onset diabetes totaled hundreds of dollars a week out of pocket and required weekly trips for refills and diabetes supplies. Christine shared this story with me after watching her mom's anguish as she struggled to afford medication and make it to the doctor week after week. Madeline in Pawtucket cannot afford health insurance coverage despite working 2 jobs. Her family has a history of colorectal cancer, but she cannot afford to get a colonoscopy. Without insurance, Madeline waits and hopes that she doesn't get sick, because that's the only option she has. For these Rhode Islanders and millions more Americans silently suffering all over the country, we must now be a voice. We must improve the quality of our health care, develop our health information infrastructure, and invest in preventing disease. We must protect existing coverage when it is good and improve it when it is not. As the President has said, if you like your health care plan, you can keep it. We must dial down the paperwork wars and dial up the information to consumers. And we must speak for the 46 million Americans, 9 million of whom are children, who have no health insurance at all. For the Rhode Islanders lining up today at the Rhode Island Free Clinic to draw straws in this great country of ours, to draw straws to see which ones will be able to see a doctor. Some have challenged the number of 47 million. There's a report from Families USA that points out that 47 million is the number of Americans who at any minute are without health insurance. If you look over the course of a year, it's more than 86 million Americans who experience going without health insurance. Government must act at last. The problems of healthcare in America are rooted in market failures. You can't wait for the market to cure market failure. We've got to change the rules of the game. You can't pay for one thing and expect another. We've got to change the incentives. We don't expect Americans to go out and build the highway infrastructure in front of their homes and businesses. We can't sit around and wait for the health information infrastructure to get built. We must act. And we can't expect quality improvement and prevention to flourish when we made them money losers for the people who have to implement and do that work. We have to correct that anomaly. Opponents of reform are arguing that this process is going too quickly, that we need to slow down, wait, pause. But you know, we've been slowed down for years. We are the champions of slow when it comes to healthcare reform. We've been slowed down for decades. When I hear from Rhode Islanders like Mel, like Christine and Madeline, I don't think we're going too fast. I think we're irresponsibly, even frighteningly late in taking up this charge. And if we wait much longer, we may be too late to avoid the tidal wave of costs that threatens to swamp our ship of state. This is no time for delay. And let's remember, even when we pass this health reform, it's still a beginning. It's not an end. We will be at work on this for a long time, but let's get started. The anguish is real, and it is everywhere. The time is now, the moment is here. Let's make this work. Let's find a way to make this work. Thank you, Chairman.